Hi everybody, I am Dr. Divakar Kudur, consultant cardiologist in People's Tree Hospital. The People's Tree Hospital come with a vision of touch, move and inspire. So last episodes, in the episode 1, you have already discussed with lifestyle of the peoples who can manage or prevent the disease of cardiovascular diseases. So this episodes I am going to speak about what are the things we require to take good healthy food habits in prevention of cardiovascular disease, either primary and secondary. We come with a concept of know your health. In that we have already launched episode 1. That episodes has been reached quite a number of peoples. They were accepted and they liked and viewed quite a number of peoples. So that makes or inspire us to come up with the second episode. In this episode I am going to discuss with what are the food required to keep our heart healthy. So in this I am going to discuss with the primary prevention and secondary preventions. In primary preventions, you know that when is the most of the heart attacks is already discussed with my colleague Akshay Kumar. This is earlier the age. The Indian population are more prone for diabetes and also the heart attack. So how to prevent that? Whether our lifestyle is making that or our food intake is doing the same diseases, causing cardiovascular diseases, or it may be the health habits also. So now coming to the food intake, usually we recommend to take less of salt, less of oil. See, every people's like they come to our OPD what to eat or what to take the food so that to prevent the secondary events in the cardiovascular diseases. See, first usually I tell them go for less of oil. In oil, they will usually ask which one is the better. See, like sunflower oil, they are much of confusing, and also most of the advertisement or most of the peoples were also coming with that which is the best oil. As it has been proved that the sunflower oil, which contains more of unsaturated fatty acids, which is more best or benefited to the heart, so because it will increases our HDL, that is the good cholesterol. So that's why it has been already proved and established that sunflower oil is the best for the heart diseases. And how much to take? It is the very questionable things, like less of oil. Maybe we require about 30 to 40% of in a day. Food should contain a 30% of oil, which is benefited for the heart too. So if you have taken a more amount of oil food, and that day make sure that you're going to burn that. So I recommend normally less of oil, like not any persons like taking a junk food and also deeply curried food is not benefited to the heart. It may hampers. So second point is I want to know like how much the oil or salt has to be taken for the patients. See, normally Indian diet contains about 8 grams of food, 8 grams of salt. So we recommended only 4 grams in a day. So at least 50% of salt should be reduced. As it has been proved that, see, we can cut down, or if you cut down the 50% of salt intake, the BP systolic pressure will come down almost 10 millimeters of systolic and 2 millimeters or 3 millimeters of diastole. And as we cut down the salt and also the oil, naturally the body will going to reduce its weight. See, it is already known that fact that the weight, if you reduce 1 kilo of weight in almost 6 months, we can reduce the systolic BP of 5 millimeters and diastolic BP of 2 millimeters. So that is more benefited to the heart. So third point, most of the people will ask us, so can we take the vegetarian, non-vegetarian food is benefited? See, normally we tell them avoid a non-veg food, or if you want to take for a non-veg food, go for only the fish or also the chicken, not red meat. So normally the red meat contains more of the oil or more of fat, that is hampers the heart diseases. The next point is the vegetable. So normally which one to better? In vegetable food, I usually recommend most of the things like all the green leafy vegetables which contains oxidation, oxidizing agents, and also less of oil food will more benefited. Normally they ask in the diabetic patients which fruit can we take. Normally we recommend only 1 or 2, like one fruit in a day, either it is an apple or it is a banana or whatever it is, at least 20 grams of fruits will be benefited to the heart. Yeah, next, most of the in OPDs patients, they around 40 to 50 years patients, they ask about, can we take alcohol? It is a, what do you call it, is most confusing things. Like, if we tell them to drink alcohol, it may hamper his daily life and social life and other aspects. So normally it has been proved that 30 ml per week will be benefited to the heart. If the patient or the person restricted to the 30 ml per week, we can encourage to take a liquid or the alcohol. If most of the peoples will not stop for the 30 ml. That's why we tell them not to go for a alcohol. We are not encouraging that. See, if the conditions, it has been already proved, like where in the Germans or in the European countries, especially in the Germans, they take a red wine. Usually that blood vessels in that patients are less of cholesterols and less of plaques. So that's why it has been proved that 30 ml per week will be benefited to the thought and well established in medical journals. So next point, as I already discussed with primary preventions, now I'll going to talk about the secondary preventions. See, in the secondary preventions, a little bit change, particularly from the primary. Whenever there is an event is happened, when the patient underwent angiogram with angioplasty, then the diseases we need to prevent further events, particularly after stenting, and also the patient will have other lesions also. To make sure that we need some programs, particularly covering up with all the medications, so that the plaque has to be stabilized. And second point, whatever the stent we have put it inside the coronaries, it has to be patent for a lifelong. And third point is the change in particularly in the lifestyles. See, those who are after underwent angiogram and angioplasty, they ask for again what to eat, what not to eat, and what are the things, the physical exercises is recommended, what is the next time, what is the stent we put it, is whether it is a lifelong or not. So first of all, I'll restrict it to myself, because see, my topic is particularly the food habits. I usually recommend the person who underwent already angiogram, angioplasty, will reduces the salt intake, come back to the 3 grams per day, and also the oil maybe like 20% in overall balanced food diet. So normally we recommend keep the LDL level, lipid profile, less than 100 or less than 80 milligrams per deciliters. So keep a watch every 6 months. Just consult your a cardiologist so that they can monitor your BP, monitor your lipid profiles, and also the other aspects in regular checkup, BP and particularly echo. We recommend once in a 6 months to follow up with the echo and say that, and ECG for the regular checkup. So third point, I'll mention about the walking. So it is already discussed that those who are already underwent angiogram and angioplasty, the walking is the best thing to do, like 30 minutes in a day. And they should not always, I recommend, they should not lift heavy weights, particularly in the bucket. A bucket water, 1 bucket of water should not be, patient should not be lifted, because all things will be pressurized. And while passing a motion also, you should not strain for that. This is more prevented, particularly in the event of secondary events after the angioplasties. So next, we recommend to follow up regularly every 6 months for the ECG and echo. This will be benefited to handle further events. I already discussed with regarding the primary and secondary preventions in food habits, how to prevent and further events of cardiovascular diseases. See, just listen this at least and share to your friends or in the family members, and regularly keep a track on your cardiac health. See, and in this juncture, I would like to thank my friends, colleagues and teachers and my mentors. And last but the least, I will thank for my People's Tree group of hospitals, and give this platform to at least help the common peoples in through media. So please like, share and subscribe through this channel, and encourage us to come up regular episodes.